Okay, I wanted to start out by showing you this cat here, Sassy the Pants. There's Smokey the Bear in the back, but Sassy Pants, she was mouth breathing, and I talked to the homeopaths yesterday that I fellowship with in the UK. And when I was talking to them, I was telling them what was going on. I showed them that she was mouth breathing, and the one lady was a vet. And she said, "Oh, you better get her to a vet because that's quite dangerous." She has a cold. All my cats have a cold. It got cold out and they're used to in the morning. I let them all out and they go chasing the rodents and all that stuff. Then I do this video and then I prepare my board for the next day and then me and Smokey go for a walk. Sometimes Sassy Pants comes with us through the whole woods and I have to carry her half of the time. But because if I leave her out there, I don't know if she'll find her way back. She's not the brightest cat. But she was sitting there. Well, first she had all this snot coming out of her nose. So I gave her allium cepa, which is onion. And when you cut an onion, your nose runs, your eyes water. So that was what I was giving her. So the nose stopped running. And I'm not sure. The lady said that, mouth breathing could be heart stuff. But I'm pretty sure it was just sinus stuff. So she was mouth breathing. And they were mentioning, she said heart. So I did give her Crataegus, which is homeopathic, what is that? Hawthorn berry, and which is good for the heart. And so I gave her that. But then, someone had mentioned aconite, and I thought about that, but I didn't really see the symptoms of aconite. So yesterday I gave her aconite, and I gave her one dose. She was still mouth breathing for a while. I gave her another dose a little later. And then I think I gave her a third dose. And then I tried and she ate because she wasn't eating, she wasn't drinking. And then I took a water, uh, what is that called? Almost like a needle, but it doesn't have a needle. But I filled it with water and I shot it in her mouth. So she drank, she ate, and then she started getting up and moving around. So now she's not mouth breathing as much. She's getting up, moving around, and she ate. So a good sign. So I gave her another dose of it. Now she was, as you've seen, she's laying there sleeping. So that's a good sign. So now my other cats are sneezing. There was sneezing involved too. So that's kind of why I gave Valium Cepa and that. So, you can't ask a cat questions about what's going on with them. So you have to observe. And that's what we do mainly with homeopathic medicine. We observe the person. We observe, what they look like, their eyes, their tongue, what snot's coming out, what color is it, what color is your diarrhea. All you can do, and then from that observation, you can ask them question. What makes it feel better? What makes it feel worse? Which is basically modalities, which I have over here. So modalities is what makes it, better by eating, pressure, worse by, but you can't ask a cat that. So you have to do more observing. So I did give her that aconite, and I didn't look it up. I want to look up aconite and see if the symptoms matched what was going on with her. So, anyways, it seemed like aconite worked. She's doing fine. I may have to dose the other cats with some aconite. So, all right, today's morning medicine is, we're in the cadmiums, which I did, yesterday? I did cadmium bromatum, cadmium fluorata, and cadmium iodatum. Today is cadmium metallicum, and today's Friday, right? Yeah, Halloween. Today's, in Halloween, what a trip. We should be giving apples or something good for them, but we're giving them all sugar. That's and then today, the cadmium metallicum is good for fluoride and aluminum poisoning and stuff like that. But yeah, that sugar is just so horrible for us. We're all so hijacked by it. Even me. I went out my dad's yesterday, and he's giving me cake, and then I ate some of their candy that they were going to hand out because I love Reese's, and yeah, it's such an addiction for all of us, and I'm not immune to it. But Monday is cadmium sulf, which is the last one of the cadmiums. And cadmium sulf is great for anybody doing chemotherapy. It helps you with the sickness and that. But cadmium metallicum is good for aluminum poisoning. So where do we get poisoned by aluminum? We get poisoned by aluminum from the pots, pans, and actually it's in our water, you know. And even, you know, if you look at the toothpaste, the back of the toothpaste, it says it's got sodium fluoride. You know, even the fluoride is a poison that, you know, they say it's good for the teeth and that. I don't know, but when I looked it up, it said when they do what was it? When they do the sodium fluoride is comes from the, yes, there was aluminum. No, I wanted the fluoride thing. Oops, get out of here. The fluoride, they use fluoride. Uh, Fluoride. I don't want that. I want definition. Fluoride in water. It's in our water. Fluoride's in our water, along with aluminum. And it, what they say that it comes from, fluoride comes from phosphates. They're basically, what is the negative of putting fluoride in the drinking water? How to check fluoride water. They say it comes from the phosphates that they use to you know, to spray on the plants to kill things or whatever. But they had to have something to do with it, is what I understand. And so they started putting it in the toothpaste and that. They say it's, oh, it's great for the teeth, but there is a warning on the toothpaste thing that you know, in case of poisoning from it, you know, taking too much in, keep it away from children at 6 because they might just eat it. um, but there's a, you know, if there's poisoning from it, you got to call the doctor right away. So obviously it's not that good for you. uh yeah. And the aluminum, you know, they use aluminum in our water, which binds a lot of the po- uh, garbage, all the junk in our water. It binds it together so they can remove it. So is there some aluminum still in our water? I don't doubt it. Sodium fluoride, aluminum in our water, sodium fluoride in our toothpaste. Is it really good for the teeth cavities and that? You know, I, has there been an experiment with that? Have they experimented? Have they done a blind study to see if there is or not? I don't know, but you know, if it's it's definitely a high, you know, if you come in contact with that, you know, in large doses, you'll be poisoned. So why would you put poison in this stuff? You know, oh, it's great for cavities. Well, you want to get rid of cavities. The sugar that we're feeding our children tonight, you get rid of that, and the cavities will go away. The what's the Barbara O'Neill? She said she never gave sugar to her children. No cavities, no desire for sugar. They, you know, they, people say, oh, here you want some short cake or whatever it is. No, we don't eat that. They don't like it, you know, and they probably don't have a taste for it. Now they did honey. She would do honey and different things like that, but you know, we are so hijacked by sugar. It's in everything, and now they're using that. What is that sugar called? High fructose corn syrup. Very cheap. It's so cheap, and they're throwing it in everything. And if you look at your chocolate bars, supposed chocolate bars, it's 20% chocolate, rest is sugar and all the other crap. But if you, you know, the now they're saying they're going to do less because the cocoa bean, there's a problem there, or I don't know why they're not able to get cocoa, but they're going to use less of it. And if you just throw the fructose, high corn syrup fructose in there, very sweet, you use less, it's very cheap to produce. And you know, now my chocolate, I do chocolate, and chocolate is basically good for you. I think I did cocoa just recently, cacao bean. I did that, and we do have chocolate coming up, which is, and it's good for you. You know, it's, you know, of course we make a medicine out of it. We made medicine out of cacao, which is the bean, and we made medicine out of the chocolate, the product that is made. But I get 90% uh, chocolate or cacao in my chocolate bars if I eat chocolate, you know, because chocolate's not, it's good for you. Caffeine, you know, it's has its positive effects, but also when we do too much of it, it has a negative benefit. Same thing, water. You drink, you have too much water, you can drown in it. But anyways, I'm going to get off that soapbox, but cadmium metallicum and other chemical combinations of cadmium have proved curative in many cases of stomach and intestinal cancer. So these cadmiums all have this intestinal and stomach cancers and stuff. So all of them have that fluoride, iodatum, cadmium, of course, and bromatum, and probably sulfuricum, cadmium sulfuricum. They all have the stomach and intestinal cancers that it can be good for. Many of these cases were caused by irritative actions of alumina toxins resulting from aluminum cooking utensils. So that's what they're getting at. These aluminum cooking utensils will cause that stomach cancer, and of course it causes dementia, things like that. Recently, the water supply of many of our cities and villages have been treated with aluminum fluoride, exposing the public to a potent carcinogen agent that has the potential to activate the disease in all those with inherited tendencies to it. So once again, you have to be. Why doesn't everybody get it? You have to be. You have to have what do I call that? I can't think of it now. You have to have the tendency to get that disease. Otherwise, most likely, that's why same thing with the flu. If you don't have the God, I can't think of the term they use. Susceptibility. If you don't have the susceptibility to that cancer or that disease inherited from your genes, then you most likely won't get it. Same with flu. Why do some people get really sick from the flu and others don't? And it's usually a susceptibility to that disease. So the aluminum stuff is causing it's carcinogen, the aluminum fluoride in our water, sodium fluoride in our toothpaste. All these things not a good idea. And I've been using it for a long time, so I may just take some of this cadmium sulfate just to, you know, cleanse myself of that situation and start using sodium bicarbonate. Is that? I forget. But anyways, you can make your own toothpaste out of some stuff. Cadmium metallicum comes between zinc and mercury on the atomic weight of 48. So that's on the periodic table. The toxology indicates vomiting, loss of appetite, emaciation. Okay, those are the things that happen to a person that's poisoned with cadmium metallicum. Sneezing and coughing with profuse secretions from the respiratory and ocular mucous membrane. So the respiratory, the lungs, the ocular is the eyes. So a lot of mucus coming out. Same kind of thing that happens. Well, the respiratory isn't with the allium cepa, but more the eyes and the nose. The first proving was carried out by Burdock in 1827. So what is a proving? A proving is you make a homeopathic medicine out of cadmium sulfate, which is diluted, potentize it, which is pounding it, to potentize the water, alcohol, whatever you're putting it in. Usually it's alcohol, and then to give it to people until they start getting these symptoms. And then you write them down and you know what that medicine's good for because like cures like. So it was with a half a grain in 1827, and later by Petrus, another homeopath. The proving was undertaken again at the instigation of the International League of Homeopathy. So, and this is in 1947. So there was a society, International League of Homeopathy, in 1947. When I talked to that dentist that they were going to pull my tooth that I needed pulled. He was like, "Oh, this must be something new." I said, "No, this has been around for a couple hundred years. 1827, 1927, 2027. That's 200 years." So, the League of Homeopathy in 1947, and a report was set up by Gutman in 1951. So this stuff was 1900 was the golden age of homeopathy. It was really big, and there's actually a statue of Hahnemann down in Washington D.C. because he took care of cholera. He took care of the 1927 flu. He had great results compared to the allopaths, what they were having with the deaths. So up to 1951. Now what happened was Rockefeller took and gave his money. I think it was the son that did it. I think the father was going to give allopath and homeopath money equally, but then he passed and his son gave all the money to, there's a report on it. I forget what it's called. But he gave all his money, the money to the allopaths, and that's when it took off. Now there's not a lot of money in homeopathic medicine like this cat. I gave her medicine. She doesn't have to be on it the rest of her life. She basically pretty much cured from that. I may give her another dose or two. She's pretty much cured from whatever cat flu the lady called it. It's not the same flu as humans, but whatever that flu was, she's pretty good. So whereas usually a homeo, and they give antibiotics and that will help something like that. But like any other diseases, they give you a medicine, they get you stuck on it. Now you have to keep buying it, and there's a lot of money to be made in that. Where homeopathic medicine, you give a few doses, or you could be up to a month or a year taking this medicine, and you really don't have to come back to see the homeopath. You just continue to take that medicine. You might consult with them a little bit here and there to make sure everything's moving along, and once that's cured, you can consult with them again to get rid of, to go through other situations that you went through in your life. Because, a different picture comes up. Once you remove a layer off a person of a sickness or once you remove that, then basically you'll see another picture come up and you can take another medicine until you get to a great health. The proving was made on 38 provers using the following potencies: 2C, 3C, 6X, 12X, and 30C. The latter potency showed no pathogenic action, so the 30C didn't do anything, so the lower ones did. In another connection, McFarlane, another homeopath, made a proving on 4 female provers using the Skinner potencies, which is a 10M and a 50M. They're really high. Templeton, another homeopath, experimented on 9 provers with 2C, and Pahud on 16 provers with 2C, 3C, 6X, 12X, 30X. So as you see, this one's been proven quite a bit. The state of psychosomatic post-influenza exhaustion, precancerous chronic infections of the anyways, I'm not going to get into all that. All right, so let's get into it. Cadmium metallicum, stomach intestinal cancer, aluminum poisonings, fatigue. Now, those aluminum poisonings can have a lot of mental stuff. Let's see, concentration difficult, weak memory. Sounds like the what they're calling what is that? Dementia. And what is the other one? I forget. Anyways, fatigue from influenza with lassitude. So whether they have the fatigue when they have influenza, which would be a gelsemium symptom, or whether they would have the fatigue afterwards, you would consider cadmium metallicum. Worse in the morning, on waking, from movement, mental effort, and left side. Uh, Better eating and pressure, bending double. So that stomach stuff, they want to bend double to get some relief, and appearance of eruption. So any eruptions that happen, on the skin and I always say that, will help the internal whatever's going on. When we put something on the skin, to cure any skin stuff, that pushes the disease back into whatever organ it's at. So the body always wants to push things out to the last organ, which is your skin. So anything that comes out of, if you give a medicine and, like if you gave cadmium sulf and they all of a sudden got skin symptoms, all the other internal symptoms, the kidneys and all that stuff would get better. Causation, aluminum poisoning, it says. Concentration is difficult, weak memory, hypersensitive, so sensitive to noise and sight and touch and all that stuff. Irritable, depressive psychosis, fear of cancer. So this depression brings on a psychosis in the mind. So that's all mind stuff. What is it called? Alzheimer's. Yeah, Alzheimer's, and what's the other one I just said? Diaphragmatic hernia. So what is that? That's a hernia where the ingestia from the stomach is coming back up into the throat. I wish I would have had this from my grandmother, because I remember she had that kind of hernia. And my wife, I wasn't using it as relevant. I wasn't using it as good at that time for all kinds of different things. But my wife had that, and she had to have her stomach surgery to tie that up so that she didn't have the heartburn coming up. So that is that diaphragmatic hernia. Now my wife had a hernia that was popping out on the right side. I gave her lycopodium. It went away. She doesn't have any problem with that anymore. This is why I want to get this into everybody's mind and in their hands so that they can take care of their cat or their dog or their family members, you know. Colitis, bacillary dysentery. So that's the bacteria, bacillinum bacteria. And we also make a medicine out of that. Distension of the abdomen. Backache with pain in scapula, which is the shoulder blades. Constrictive pain behind sternum in the chest, especially when coughing. Now, bryonia, when they cough, they hold their chest because it's so painful. So this you'd consider that with cadmium metallicum. It could be one or the other. Buzzing and painfully sensitive, just like the cat. I was giving her allium cepa, kept giving it. Now the nose cleared up, but she was breathing through her mouth, and obviously it was a stuffy nose. But and then I had to go to aconite to relieve that. So you're choosing between medicines, and sometimes one doesn't work. You just give the other. You're not going to hurt somebody if you give the wrong medicine. It just won't do anything, or it'll palliate symptoms. Like when I gave my wife calc carb for the pains in her legs. Oh, my pains are better, she said, but when she didn't take the medicine, it kept coming back, and I would do shiatsu on her legs, deep pressure, and it'll make it feel better. Finally, I gave phosphoric acid. Now I don't even have to push on her legs anymore. It's fine. But she has that bump on the bottom of her foot that I did, I talked to the homeopaths again in the UK when we had a meeting together, and the one lady said, "Well, you ought to look at, according to reflexology, what point is that?" And that's the kidney point. And she ate a lot of Tylenol PM, which Trump said quit taking Tylenol, which I agree with basically. But Tylenol PM, undoubtedly, the amount she was taking, when she had that headache, she said, I took 10 Tylenol PM and I can't get rid of the headache. I gave her arsenicum because it was burning. Headache was gone in like 10 minutes or whatever, whenever I come down from my shower. But that point in her foot is kidney point, and that can be, so I got to go to berberis or some things to support her kidney, and that might take care of that bump on the bottom of her foot. But Ruta is one I would give for such a thing, so I keep giving Ruta, give some berberis every so often to help get through that. I know I'm getting throwing a lot out there, but constrictive pain behind sternum, okay, buzzing and painfully sensitive ears. So that's why I say hypersensitive. So painfully sensitive ears, sensitive to light in the eyes, that's that hypersensitivity. Eyelids are painful and sensitive and burning. So there's that sensitivity. They got burning in the eyelids. Worse reading in hot rooms. No face. Uh, no female, I don't think either. Headache comes. Oh, I put head up there because there's a lot to the head. So let's food. Insatiable hunger with nausea, aggravated by jarring with and they can have loss of appetite. So that nausea, they have a hunger, but that nausea probably caused them to have a loss of their appetite. Better by cold compresses on. Oh, this is the head. Let's see. Okay, let's do head. Occipital headache with vertigo. So they have this headache in the back of their head with vertigo and buzzing in the ear and visual psychosomatic complaints. So, anyways, mental visual stuff going on. Uh, Better by cold compresses, holding head, eating, accompanied by nausea. So this headache's always accompanied by nausea. They want to hold their head. They eat. It feels better. But of course, when they eat, the nausea and the aggravation is there. Movement, worse by movement, reading, intellectual activity. So it's worse by that. And morning waking. So when they wake, they get that headache. Reading, any intellectual activity, any movement. Headache comes and goes suddenly, aggravated by shaking. So any movement makes the headache worse. No heart, frequent urination with the kidneys, limbs, paresthesia, which is pins and needles, so that it goes numb. Especially if they sit in too long and that, their legs will go numb and things. But that's that pins and needle is paresthesia, thesia. Weakness, trembling in the feet and hands, so a lot of trembling going on. Heaviness, in the limbs, burning in the feet, and formication, which is once again that like that pins and needles or that numbness. No liver, lungs, respiratory difficult, especially with slightest movement. So any movement, they have a hard time catching their breath. Cough, and that can be in the flu or whatever. Cough with mucopurulent, sometimes blood-streaked sputum. So a lot of this isn't coryza. Coryza's thick. This is just a lot of mucus, and that's what my cat had. A lot of mucus running out of its nose. I mean, her nose was just dripping with mucus. And when you see that, you might think of Cadmium metallicum. Male, nothing. Teeth are yellow. Now we think yellow because of what we're eating or drinking, but that's something different there. That teeth yellowing can be just from the sickness or the thing going on with a person. Mouth is dry, lips are itching, nose sneezing. My cat had that, sneezing, a lot of sneezing. A lot of them are still sneezing. Constipation with hemorrhoids, aggravated by passing stools. So the hemorrhoids they have constipation. When they pass stools, it really aggravates their hemorrhoids. Diarrhea can be the opposite end of this. Soft with sensation of foreign body and rectum. So when they have this diarrhea, it feels like something's in their rectum. Sensation of heat on the skin or burning in small areas of skin. Localized itching. So they have heat in just one area, not over the body, and itching in the localized area. General fatigue. Appears with eruptions. So they get fatigue, general fatigue. I want to say that's better. Disappears. Oh, that's what the word is. Disappears with eruptions. So they have this fatigue, like it says up there, fatigue and lassitude and influenza or whatever. But when the eruptions come to the skin, that goes away. Lupus, which is that autoimmune stuff attacking the skin. Tuberculosis with papules and nodules. So tuberculosis, anybody having tuberculosis, they would have these nodules and that on the skin. Sclerosis lichen, which is genital and anal white patches that are itchy on the um, anus and the genitals. Chronic pustular dermatitis spreads away from the center of that, wherever that pustules are. Okay, blood. Acquired hemolytic, which is anemia. Jaundice, their skin's yellow. That's from kidney stuff, frequent urination, so they have kidney stuff, obviously. Anemia and chlorosis. And chlorosis is the skin turning blue. I'm pretty sure that's what that is. In young girls. Infantile hereditary anemia and basic anemia. So young people have an anemia, young girls have an anemia with blue skin. Acid dyspepsia, that's that, where is that? The abdomen, that diaphragmatic hernia can bring on that acid dyspepsia, which is just heartburn. Glandular fever, mononucleosis, good for mononucleosis, which with a gland fever. Cold even near a fire. So when they get somewhere where it's warm, they're still cold. Goosebumps, and that's from that anemia. My wife, she says, "Oh, I'm cold, man." Well, you're anemic. Goosebumps, shivering without fever, dry morning. Throat is dry in the morning, improved by eating. Okay, let's get in. It might go a little long today. I did the folklore. Now I'm going to do some comments. Cadmium metallicum produces an impulsive irritability, skirting the verge of insanity in its violence, so that they're just so irritable it makes them almost insane. Alternating with deep depression, they're just depressed, loathing of life, hopeless, and apathetic. They don't care. They just don't. Who cares anymore? All joy is gone. This is a common mental complex in cancer patients. So when they're, especially in a cancer patient, they have that feeling. They are unable to concentrate, saying and doing the wrong things, such as putting salt in tea instead of sugar. Vivid, unhappy dreams of sickness, causing worry after awakening, averse to people, to certain kinds of music, to noise. That's that hypersensitivity. Odors and other unpleasant stimuli induce nausea. Even thinking of it, those sounds and those noises and all that stuff gives them that nausea. Objects recede and return, so they see things and then they don't see them, and that's very interesting there. Vertigo while looking at moving pictures, accompanied by sensation of something taking the breath away. Okay, extreme constant neuralgic headaches, maddening, pressing pains throughout the head, extending to the eyes and the ears. Old ear discharge with ear pain. So they'll have that otorrhea coming out of the ears. Otitis media, I think they call it. Some pressing pain in the liver and spleen. Violent vomiting attack with headache. So anytime they have that headache, they get this vomiting. Alternation of heat and coldness. Vomiting of bile and acid, diarrhea of black, musty stools, accompanied by intestinal pains. Constipation, on the other hand, with clay colored stools, and breasts feel enlarged and sore, intense squeezing pain in the region of the heart, with a sense of weakness, more frequent urination, and discoloring the toilet bowl brownish or deep lemon color. Very difficult to wash from the bowl. I don't know what's going on there, but they're the kidneys putting out such strong urine that it's actually discoloring the bowl. Cadmium metallicum causes numbness of feet and hands when patient is sitting. So that's that formication and that paresthesia, which is pins and needles. Hemorrhage of bladder and the rectum was cured many times by Dr. Grimmer. So bleeding from the bladder and the rectum, especially when dark colored blood with small clots was present. Bright red hemorrhages have also been observed. So it's either dark or bright red. Severe neuralgic pains in the face with plugged sinus, followed by facial paralysis. So the sinuses are plugged. They got faces numb after large doses of quinine, which is mercury, and aspirin. Cured with one dose of cadmium metallicum 10,000 C. So they're taking mercury, that's what they used to give, and aspirin, large doses, and their sinuses get plugged. They get a face that goes numb, and cadmium metallicum 10,000 C cured that, according to, who was that? Grimmer. All right, cadmium sulf is another one you would consider with this, some of these symptoms. Bryonia, also aggravated by movement, constipation, intensely thirsty. And if you're considering agitation with anxiety, burning, ameliorated by heat, you'd consider arsenicum with that. So that's cadmium metallicum. And I'm a minute over, but you can age. You don't have to get old. What do I mean by that? What you eat, how you move, your mental state, the amount of stress you're under, things like that. You always get old. Your age, your numbers will go higher, but you don't have to get old as far as moving and looking old and all that kind of stuff. So, anyways, that's morning medicine. And as I always say, you can age, but you don't have to get old.